believe healthcare is a quality of life issue. As much as we look at codes and crime, if people can't access healthcare, it makes it very difficult for them to live in a community. I'm disappointed in the healthcare industry, even though I know it's profit-driven, that it still can't look of a way of investing in the health of our city residents. And I think we need to make a concerted effort with our federal, state, and local officials to really push on what do our citizens need and how they can most easily access these services. I believe one way we can start is we do have a Board of Health. Over the last several years, Council has worked very diligently to really improve the Board of Health, to really help them focus on the important issues. I think a next good step is to be able to have the Board of Health look at the healthcare issues facing the citizens of the city and to come up and back to Council, back to the administration with recommendations for a plan. What are the needs and how can we impress upon our state and federal officials to really bring the quality of healthcare that our citizens deserve? Thank you.
We have the best healthcare system in the world. What we don't have is access to it. It's all about insurance. There's our problem. There's only one solution that I find viable, and that is single payer. Medicare for all, call it. Look at the history of how we got into this problem. No other nation followed us down this road where employers will be in charge of our health care. That happened as a result of World War II, when we didn't have the manpower. And because wages were rising so fast, President Roosevelt put a freeze on all wages. So employers came up with these benefit packages, such as health care, to attract workers. This is how we went down this road. Now, we are told over and over again we live in a global economy and we have to compete with all these countries in the world, even if they're communist dictatorships. Well, let me tell you, it doesn't work. We have to have the same system that they do, where government provides, because these corporations can move over there and not only pay their employees 10 cents an hour, they pay them anything, but the government is providing their health care. So this is an unfair advantage. So I absolutely think single payer is the way we have to go. Thank you.
Healthcare. I believe we all care, or we all have families, so we all have an issue with healthcare. We all want the best for our families. I'm a paralegal. I work for a law firm that deals with workers' comp and Social Security disability. I see a lot of families that come through my office that say, you know, they want an attorney because of certain issues and because of certain accidents that they have at their job. And then what happens? They don't have any health care. Okay, how do we help them? How can we help them? By letting them know that they have other places that they can go. We have a lot of organizations in our community that can refer them to places where they can access health care, such as the Reading Hospital, the care management that they have. Now, a lot of people don't know that. The county, the new system that they have with the free Medicare for medical, for their payments, a lot of people don't have that. But most of all, in order to change legislation, and I am coming from working with Congressman Tim Holden in prior years, we need to access our legislators in order to change legislation, in order to have better health care. Thank you.
Much like the panel said, it is a federal issue, and what we need to do exactly is to put the pressure on those people that actually have power in making those decisions. Numbers speak volumes, and if we don't come together and start putting pressure on the things that we need for this community, it's not going to happen. We can talk about it all we want, but until we become accountable for the things that we need for this community, we can talk all day. Yeah, we definitely need to put pressure on jobs that we need here. We need to put the pressure on for the health care. We need to put the pressure on for all the things that we need for the city. And if we don't come together, once again, and do what's necessary to make this community healthy in all aspects, it's just not going to work. We have to work with the city. We have to work with the school board. We have to work with our state reps. We have to work together, to come together to make this work for our city. Thank you.
Yeah, I'm going to need help here, right? To me it comes back to family. I grew up for many years in Oakbrook, and there were people who fed me that I didn't know, and there were people who cared for me that I didn't know. And you know what? It was always family. They were always family. And there are programs that exist, and there are people who don't know. And it's our job as a community to get those who don't know to those places. And it's certainly our job, I agree with everyone, to put the pressures where we need to put them. But as we all know, that takes time. It means we do it and we get it done. But at the same time, we've got to look out for the person who doesn't have health care. We've got to help guide them. That's everyone's job. It can't be city council's job and it can't be the mayor's job. All of us have got to think, he may not have health care, where can I refer him to? We can help try to promote those resources to everyone. Vaughn mentioned the EMS service. We have perhaps the best EMS service in this county by far. So any child that you see in this room, if they became suddenly struck with an emergency situation, in 3 minutes or less, we had service. So we fought hard to think of everyone's protection. That's all I have time for. Thank you.